Today's topic is diet therapy, chapter 11, page number 206. Those who have the new textbook, please mention the page number in the chat box. Maybe there is a slight difference in the page numbers of the latest edition textbooks. So diet therapy, it is concerned with modification of normal diet to meet the requirements of any sick individual. Okay, when you are going through certain health conditions, along with some medications you may be prescribed on, some modification may have to be done to the diet, okay, to accelerate the healing, to accelerate the way how your medicines can work within your body, okay, because there is always an interaction between drug therapy and nutrients, okay. Certain nutrients can affect the efficacy of the drugs that you are taking, or certain drugs can reduce the absorption or the way how nutrients work within your body. Okay, so keeping that in mind, doctors will suggest some specific kind of diet, okay, on top of your regular diet, some specific addition, subtractions, modification, portion control, okay. These strategies are usually used in diet therapy. It's not a remedy, okay. Diet therapy is not supposed to cure you. It is just is available to assist the medications, okay, to help the treatment go in alignment with your diet, okay. That is the purpose of diet therapy. It makes medical or surgical treatment more effective as compared to continuing the same old diet. If you make certain changes in your diet, if you're undergoing some medical situation, or if you're recovering from surgery, or you're preparing for surgery, these areas will become more effective. So what are the purposes of diet therapy? To maintain good nutritional status, okay, to correct any micro deficiencies or macro deficiencies, energy requirements, patients who are on weight management, okay, or weight gain, whatever is their purpose, okay. To fulfill that energy requirements, diet therapy is followed, okay. It keeps you on track. When you follow diet therapy, your energy requirements are on track. Either you are on a calorie deficient diet, or a high calorie diet, based on your requirements, based on your personal goals. To meet those energy requirements, diet therapy is followed. To correct deficiencies, micros and macros, to afford rest to the whole body. Okay, diet also helps in allowing your body to rest. If you have rich, heavy food, okay, dense, creamy, and it is fat-rich food, your body will usually take time to recover, to metabolize it. Okay, metabolism takes a toll on your body. Your body is continuously working hard to break down the food. Okay, when you have some light diet like soups, salads, and all, your body does not have to overwork for breaking it down. Okay, so your body can get enough rest. Along with that, metabolism is also taken care of. To maintain your body's metabolic ability, for example, when you are on a diet, especially when you go into crash diet and all, okay, 4 or 5 days you will not eat anything, you will just be fasting. Something like that is called a crash diet. It's just to reduce a lot of weight in a very short span of time. Okay, these are called crash diet. So when you undergo these kind of diet, it definitely affects the metabolic ability of your body. Your metabolism also goes down when suddenly you stop having your regular calories that you are supposed to have. Suddenly your metabolism will go down. It will also change your body weight as well. Okay. And changes in the body weight in the sense increasing the weight, decreasing the weight, body weight. That these are our personal goals. Every it is very subjective to everyone. So these are the main purposes of diet therapy. Next, coming to glycemic index. Okay, always remember glycemic index is a ranking system. Okay. Ranking system means what? Certain food have been tested to check how they will increase your blood glucose level. Okay. And the food that give you immediate spike in the blood glucose level are considered high glycemic index food. Okay, the red peak that you see, those are this is how the high glycemic index food will work in your body. Okay, for example, we'll start with the bottom line here, 0. This is where you didn't had any food. You are in the fasting state. Okay, if you have a cup of tea with sugar on an empty stomach, immediately your blood glucose level, after getting absorbed, immediately the sugar will be absorbed from your intestine, blood glucose level will also increase, and suddenly it will fall as well. Okay, a cup of tea with sugar in the long run will not sustain you. You will have an immediate rush of energy, then again you will fall down, you will come crash. Okay, there will be an energy crash. So that is a high glycemic index food. Medium glycemic index food, if you eat on empty stomach, you can see it slowly. It will also increase the blood glucose level, definitely, but at a much slower pace. And also at a much slower pace, it will come down. Okay, so you will not get an immediate rush of energy. The energy is will slowly build up. Okay, and again you will not feel that energy crash. The energy that you have gained through food will last a bit more longer. Okay. Now, when you have the low glycemic index food, like salads and all, legumes, salads, high protein food and all, okay. So very slowly, because your why this much time is been taken by your intestine to absorb it, because usually these are complex food. Most of the complex food are low glycemic index. Complex means what? They are not that easy to break down and digest. They spend a lot of time in your stomach, in your intestine. Okay, they get broken down very slowly. Okay, and only when the food is broken down completely, it could be absorbed, right? So the breakdown of the food only takes a lot of time, and by the time it is absorbed, not much carbohydrates are released into the bloodstream. Okay, they are low on, usually these low glycemic index food are having good carbohydrates, complex carbohydrates, okay, which don't spike your blood glucose level. Okay, so at a very slow pace you will get the energy, and the energy is also sustained for a longer time. Okay, so that is low glycemic index. So this is the formula. A slightly different formula is given in the textbook, but that is also fine. Okay, so what is this incremental blood glucose area? When you are fasting and when you have your first food. Okay, usually if it is a carbohydrate rich food, every hour, every half an hour, there is an increase in your blood glucose level. Okay, you can just understand this as these dots that you see. Okay, let's say every 15 minutes they were collecting the dots. Okay, every 15 minutes random blood sugar test was done, not random after fasting. Okay, every 15 minutes the blood was checked to see if how the blood is acting. Okay, So each time when they checked the blood glucose level, soon after having giving a simple carbohydrate food, okay, there is a high spike and then a high that a steep crash. Okay, so this is how they analyzed the glycemic index of various food. So incremental blood glucose area of 50 gram of carbohydrate test food. What is this test food? It's usually whatever food you want to check its carbohydrate content of. Okay, for example, if you want to check the how soybean will increase the blood glucose level, how sabudana will increase the blood glucose level, how tapioca, okay, or chicken breast or chicken thighs or chili chicken, okay, whatever food, okay, how it will increase the blood glucose level. So these are test food. You want to test, you want to know how this food will act in terms of your blood glucose level. Okay, and what is the denominator? Again, denominator is also incremental blood glucose area of 50 gram of carbohydrate reference food. Reference food is usually either sugar or plain white bread. Okay, either sugar or plain white bread is what we usually use as a reference food when it comes to checking the glycemic index of any test food. Okay, so every food is tallied against either 50 gram of sugar or 50 gram of plain white bread. Plain white bread is usually commonly used everywhere. Okay, because it's simple. Plain white bread is a simple carbohydrate. Okay, not much nutritionally dense. And immediately, if you have some plain white bread, immediately your blood glucose level will also spike up. So that is the reason why plain white bread or sugar or glucose also is used. 50 gram of glucose can also be used here. Okay, multiplied by 100. So this is how you will get the glycemic index. Whatever answer you get here, then we have a range for it. Okay, it should be less than certain number, only then we will call it low glycemic index. If it is in the range of certain numbers, it is called medium glycemic index. If it is above 70, it is high glycemic index, like that. Okay, whatever answer you get here will put the food into that rank. This is just a ranking system. Okay, just a ranking system. The first rank usually goes to the food that are quite good for your health, that don't cause immediate blood glucose level. Okay, any food that has got ranking above 70, okay, the 70, 71, 72, like this rank, any food that comes under this category of ranking, they are high glycemic index food. Okay, so what are the factors that affect your glycemic response? The way how you eat food, okay, the way how you combine your carbohydrates with certain food, certain combinations, okay, the all the other items that are present in the meal. Okay, for example, if I say I gave you a small katori of rice, okay, and then I give you a small katori of rice and curd, rice and curd, and then the another option is just plain white rice. The second option is rice and curd. Which do you think is digested more quickly and easily? Plain rice with curd will be broken down very easily. Okay. Plain rice with curd, it will take time. Plain rice, just plain rice will be broken down very easily. Okay. Plain rice, if you just have plain rice, just the rice, okay, with nothing, immediately your blood glucose levels will spike up. And when you combine rice with curd, blood glucose level will not spike up that soon, even though it is good on stomach. Okay, understand the difference between this. Whatever is good on stomach is not necessarily easily digested, right? If you compare plain rice and rice with curd, plain rice is easily digested. It's not that good for health. Okay, it immediately causes the blood glucose level spike. When you combine the rice with curd, curd has protein, curd has fat as well. Okay, so it will take time for your stomach. to assimilate in the intestines also, to assimilate the carbohydrates and fats and protein. Okay, differentiate them. Take one by go into the chyme and get the nutrients. It will take time because the presence of protein and fat will definitely affect the glucose spike. Okay, there is a way how you combine food to avoid immediate increase in blood glucose level. So first is the rate of ingestion. What is ingestion? When you eat food, when you swallow food, when you chew and swallow food, that is called ingestion. Okay. So higher the rate of ingestion, more will be the blood glucose level. For example, uh, if I give you a glass of orange juice, okay, made out of 2 oranges, and I give you 2 whole oranges, you have two options: a glass of orange juice made of 2 oranges, and the second option is just to eat the whole fruit, orange, 2 oranges. Which do you think has a higher rate of ingestion? Which do you think is quickly gulped down? It's definitely the orange juice. Okay. Anything that enters your stomach quickly, leaves the stomach even more quickly, gets absorbed into your system very rapidly. Okay. But when you eat a whole fruit, there is an element of fiber in it. And fiber will make a gel like mesh and all that. Okay. It will protect certain nutrients. It will not allow the digestive enzymes to break it completely. So orange, a whole fruit orange has to go through a lot to get digested or to get metabolized. But plain orange juice, nothing. There is nothing there is no fiber in it, right? So rate of ingestion, how quickly you eat food. So that's why when we say you should always eat your food very slow, take your time in eating your food, be mindful about eating your food, chew your food properly. Okay, this because it affects the glycemic response. People who are very quick in eating their food, even if they're doing portion control, even if they're having the right amount of food and all, it will still affect their blood glucose level. That is the importance of rate of ingestion. Then food components, protein and fat content. Okay, that will also reduce the glucose spike because your body takes time. Whatever comes with fat and protein, your body will need time to process it, digest it. Okay. Groundnut milk, these all have low glycemic index. Okay, even ice cream has low glycemic index. Why? If I give you a bowl of ice cream, 100 gram of ice cream and 100 gram of watermelon, okay, even though ice cream has a low glycemic index, watermelon's glycemic index is above 70. Okay, which do you think is relatively healthy if you just go by glycemic index? It's but by the number, it says that ice cream will be much more healthy. But that is not the truth. Okay, we know that ice cream is not healthy. Why? But why ice cream got low glycemic index and watermelon did not get low glycemic index? It's because of the presence of fat and protein. Okay, ice cream which is made up of milk, it definitely has protein. Milk has fat. Ice cream is also like when you take frozen desserts and all, it's completely fat, right? So that's the reason why it will not increase your blood glucose level, especially sugar-free ice creams and all. It will not cause spike in your blood glucose level, but it has other health hazards like cholesterol issues, fat issues, overweight issues. These things will come with ice cream, getting cold, getting fever. Okay. And watermelon is low on fiber. Watermelon, 90% it is just water. Very low on fiber and high on fructose. That's the reason why watermelon has high glycemic index. So that is one example of food components. Then when you combine complex carbohydrates like starches and all, okay, uh, unripe banana, potatoes, uh, rice which is cooked, boiled rice which is cooked and all, but then you allow it to cool down and then have the rice. Okay, it becomes resistant starch. Potatoes as well. You make a potato curry or something in the morning, you eat it after 2 3 hours. Okay, resistant starch will begin to happen. Resistant starch also acts like a nutrient, especially for prebiotics and probiotics. Then methods of cooking also is involved in judging what kind of glycemic index you will have. Usually when you boil a food, steam a food, okay, it is much more healthier than deep frying and sauteing the food. So even though if you are buying something that is sauteed or deep fried, it could still be on a lower glycemic index because too much of fat is there combined. But still, on the health perspective, it is known that it's bad. Okay, so steamed vegetables, pressure cooked food, steamed food are much more healthier as compared to deep fried one, sauteed one, oil fried and all. Okay, so methods of cooking and processing also decides what will be the glycemic response. Also, when you look at the types of rice, parboiled rice, white rice, red rice, mata rice, different types of rice. Parboiled rice has lower glycemic index as compared to white rice. So if somebody is from the staple of having rice, okay, South Indians and all, East Indians, they can't switch from rice to chapatis. Rice is a staple. So again, in rice, you will find certain types of rice which naturally has low glycemic index, like boiled rice and all. Okay. And also, if you want to make white rice more healthy and more accommodative for your gut, you have to make sure that when you cook white rice, you should not be eating it immediately. Allow it to cool down. Allow the white rice to cool down, or keep it in the refrigerator to cool it down, and then later on you can have it. Or make the white rice early in the morning, okay, and then in the afternoon you can have it. Let the rice completely cool down. Okay, even though if you reheat it, resistant starch does not go anywhere. It is still there. Okay, just a minute. Okay, so that is how methods of cooking and processing. And when you cool down the rice, the starch again condenses. Okay, when you eat white rice immediately, the carbohydrates are very loose. Okay, they are formed very loosely. So in your enzymes, the acid in your stomach, the enzymes of your in your intestine, they can easily break these loose structures. When you allow it to cool down, they reform. Okay, the starch structures, the carbohydrate structures, they reform. Okay, and they form a very firm hold on within each other, which is much more difficult for your intestines, your acidity in the stomach to break this bond. It takes time for your stomach to digest it. Cool down white rice and all. Okay. So fried rice and all, if you prepare it in a healthy way, it's a good. Like fried rice, you have to use the cool down version of the rice. Okay, the rice that is been refrigerated. Okay, you add more vegetables into it. Okay, don't use MSG. Don't use too much of soy sauce or something like that. You can make it into a healthy food plan as well. Okay. Polished rice will always have higher glycemic index as compared to unpolished ones and parboiled ones. White rices, they come under the polished rice category. Then physiological effects of your body having enough acidity in your stomach. Okay. An increase in acidity of a meal can immediately lower your GI index. That's the reason why I have mentioned many times in the class. Okay. You can search this online as well. If you drink vinegar water before your lunch, before your meal, okay, 5-10 minutes before your meal, take a teaspoon of vinegar, put it in water, and drink it. So usually, it's better to use a straw, okay, so that you don't corrode your teeth enamel. Okay, don't drink it from the glass as it is, because it may slush in your mouth. And over a period of time, vinegar, which is acidic in nature, you do not want it to cause much harm to your teeth enamel. Okay, so just 1 teaspoon of vinegar in a big glass of water. Okay, you drink it. What you're doing is you're giving acidity to your. It's not a bad acidity. Okay, you're making your stomach more acidic in nature. Okay, and then you have your meal. Then you, especially when you have your protein, and then you have your carbohydrates. So what happens is that the more acidic a meal is, your apple cider vinegar is not much of a help here, but you can still use any vinegar. Don't use the balsamic vinegar because it has a lot of sugar in it. Okay. So any vinegar in which acetic acid is the main content, not citric acid, acetic acid. Okay. Citric acid is found in sweet lime, amla, okay, oranges. They all have citric acid, but the pH level of the citric acid and the amount of citric acid required to control the glucose as compared to acetic acid, okay, is you require much higher dose of citric acid as compared to what acetic acid at a much lower dose what it can achieve. Okay, so any vinegar, check the vinegar, check the ingredient of the whatever brand you want to buy. Check the ingredient. The main ingredient should be acetic acid. Okay, acetic acid and water, aqua. This should be the main ingredient. Search for this, whatever brand you want to search. Okay. So that's how we drink that water before your meal. Then have your salads, whatever is your simple salads. Okay, even if it is just half a cucumber, some cucumber cut, carrots, okay, and some cabbage, whatever is your salad preference. After having this glass of acetic acid water, have your salads, then have your protein, paneer or burji, eggs, okay, and then have your carbohydrates, dal, rice, sambar rice, rasam rice. Carbohydrates, keep it to the last. Okay, so 1 teaspoon of vinegar. Yeah, it can be used as salad dressings as well. Okay, and also if you are using the pickles, not the Indian pickles, not the spicy one. Okay, the pickles that you put it into the vinegar with some spices, some garlic and some peppercorns. You keep it for a week and then you can use it. Carrots and all, which are pickled like this. Okay, like Syrian pickle kind of a situation that anyone can do it at home. Okay, so having those pickles also, Yeah, lacto-fermented pickles and all. This is also good. Start your meal with that. And then have your rest of the meal. Protein, go for protein and then go for carbohydrates. Keep the carbohydrates at the last so that it takes a lot of time, lot of digestion, okay, assimilation and all it takes. And then carbohydrates come into the scenario. Okay. So very slowly, even after having meal, very slowly, now you have your meal, you kept carbohydrates at the last. Okay, it could be after half an hour or 1 hour you may have a glucose spike, so your body has enough recovery time and all. Okay, you have to add it into water. Okay, don't drink vinegar as it is. This is the classification of glycemic index. If your glycemic index range is if for any food, if it is less than 55, it's we call it low glycemic index. Most of the fruits, vegetables, bread, brown rice, fish, egg, they all come under this category, except for potatoes and watermelon. Watermelon has a high glycemic index, okay? It's more than 70. Then medium glycemic index, 56 to 69. If you remember the formula which we have shared initially, when you get an answer out of that formula, where that will tell what kind of glycemic index is this test food. Test food is kept in the numerator, reference food is kept in the denominator. Chicken does not have carbohydrate, it is just protein and fat. Chicken is low glycemic index. Okay, it does not have carbohydrates. The only carbohydrates you get from animals is milk, lactose. Okay, it's more or less the same. Don't worry much about the units. It's more or less the same. Okay. Earlier, this was the glycemic index range which was used earlier. Now, after upgradation, maybe they are using the recent ones which are mentioned in the textbook. 65 to 75 is called high. 30 to 40 is called low glycemic index, like legumes, nuts, and all. 45 to 55 is intermediate or medium level glycemic index, fruits, unrefined cereals. And there is a table 11.1 in the textbook, page number 209. So that you can check lot many usual food items that we use in Indian cuisine. Okay, what are their glycemic index they have mentioned? It's plus or minus 2, 4 and all. It's just the ranking difference. Okay, some laboratories which have checked the glycemic index, some may have got a little bit higher number, some may have got a little bit lower number. So keeping the plus or minus will not completely change the type of uh, glycemic response. Okay. Then we have glycemic load. So remember I was telling that when we talk about glycemic index, it's a ranking system. You are just ranking the food. Okay, it will not change much. Rank once you have ranked a food. Okay, once we know that watermelon's glycemic index is about 70, it will remain 70. It will not change suddenly. After 10 years, glycemic index will be 65 or 85. It will not be like that. Glycemic index is a ranking system. Okay, it will remain the same. But glycemic load, this will tell you the meal that you have had, how exactly is it affecting you? Because it gives you the number of carbohydrates you had in your meal. Okay. For example, uh, 50 gram of watermelon and 500 gram of watermelon, half a kg watermelon and 50 gram of watermelon. Will their glycemic index change? 50 gram of watermelon, 500 gram of watermelon. Will the glycemic index change? No, it will not change, because glycemic index is not meant by weight. How much gram is there? Quantity is not taken in glycemic index. Okay. 50 gram of watermelon will also have 70 as a glycemic index. Half a kg watermelon will also have 70 as a glycemic index. Okay. But glycemic load will change. Why? 50 gram of watermelon, there is a specific number of carbohydrates present in that. Half a kilo watermelon, much higher number of carbohydrates is present in that. So we are taking into account the amount of carbohydrates present in terms of grams. So how much are you having? That matters in glycemic load. In glycemic index, what are you having? Glycemic load, how much you are having. So these two questions are completely different. Okay, what will the glycemic index will give you the answer of what are you having? Is it a high glycemic index, low glycemic, intermediate glycemic index food? Okay, how much are you having? That answer will be given by glycemic load. How much is too much? How less is too less? Okay, this answer will be given by glycemic load because we are considering the gram of it. Okay. If I give you 50 grams of rice and 100 grams of rice, definitely the way how your body will respond will be different, right? With 100 gram of rice, more blood glucose spike will be there. Okay. But when you see glycemic index, you just know what is the glycemic index of rice. Okay. White rice is about 73. Brown rice is about 68. You just know that. But how much gram of how much white rice, how much brown rice, you do not know that. You just know if it is white rice, this is the glycemic index. If it is brown rice, that is the glycemic index. It will not change anywhere. In America also, the glycemic index is the same. In India also, it is the same. It will not change. But glycemic load, how much of this rice are you having today? Okay. So carbohydrates in grams multiplied by glycemic index divided by 100. For example, if we take 100 grams of white rice, you can just Google it, 100 grams of white rice, how much carbohydrates are there? Okay. In 100 gram of white rice, how much carbohydrates are there? That number will come here. Carbohydrates in grams multiplied by glycemic index. What is the glycemic index of white rice? It's about 73. Okay. So how much our carbohydrates you got from online? Okay. 100 gram of white rice will have this much carbohydrates. Okay. It's around 300 or 400 calories of carbohydrate, something like that. Okay. So that multiplied by the glycemic index 73 divided by 100. That's how you find the glycemic load. Okay. So glycemic load also has a range. If it is less than 10, it is a low glycemic index food. You can liberally eat it. Okay, diabetic friendly as well it is. And if the glycemic load is between 11 to 90, medium glycemic load. High glycemic load has to be avoided for diabetic patients, overweight patient, obese patient, heart patients. Okay, high glycemic load index food has to be avoided, which is more than 20, equal to or more than 20 comes under high glycemic load. So glycemic index, as I mentioned earlier, it just ranks your carbohydrates based on their immediate blood glucose response. I give you 50 gram of sugar, okay, and every 15 minutes I'm collecting your blood and plotting it in the graph, how your blood glucose level is increasing after I gave you 50 grams of sugar. How soon it is going up and how soon it is coming down. Okay, continuously I'm plotting it on the graph. And then I give you 50 grams of, let's say, carrot, boiled carrot. And then again, I'm doing the plotting work. So I'm just seeing what is the quality of the food, sugar and carrot, what is the quality of it? That we are just finding. So it usually gives you the quality of the glycemic quality of the food. Okay. High glycemic quality means it will not cause much trouble in your blood. Okay. Low quality glycemic index food means they are quite sweet, very sweet. Okay. And they're high in simple carbohydrates. And then you have glycemic load. It helps predict the blood glucose response, okay, to a specific amount of specific carbohydrate in the food. Okay. For example, um, 50 grams of dal, 70 gram of rice, 30 gram of potato sabzi, something like that. So individually, we will calculate the glycemic load of all these recipes and see what is the average. That will give you the average glycemic load, and that we can say this meal is not fit for diabetic and this meal is fit for diabetic. Okay, so that insight comes from glycemic load. It gives you the quality as well as the quantity. Why it is giving the quality as well? Because if you look at the formula here, we are using the qualitative element glycemic index in the formula. So automatically it is giving us quality as well. Quality of the carbohydrates and quantity. Why quantity? We are writing here how much grams of carbohydrates is present. So quantity and quality both are considered in glycemic load. Is it clear to all? Formula is slightly different in the book. You just have to understand what is the concept of glycemic load. Okay. The one that I have shown you on screen is much easier to understand the concept. Once the concept is clear, you can just read through different formulas. Then we have dietary supplements. Different forms of dietary supplements are used to overcome certain challenging situations in health. So, what are dietary supplements? They're usually a group of products which are intended to supplement a diet. Dietary supplements are not substitutes. Remember that. These are supplements. They supplement your diet. You have a diet, these are add-ons. Dietary supplements are an add-ons to your diet. They don't become the diet. Dietary supplements should not become the diet. Okay, they are just add-ons. Okay. Usually they contain mineral, vitamins, amino acid, herbs, some botanical elements. Okay, some combination of all this is usually used by normal people who do not have any disease condition. Even they use it for their overall well-being. So next, different types of supplements. Okay, purpose of supplements, why dietary supplements are used. They have given you the points. Just go through it. Just read through it. Very understandable. So types of supplements, you have herbal supplements, Ayurvedic supplements and all like ashwagandha, shadavaris, triphala, these things which are used, regularly used. Okay. Betel nut juice, turmeric, which is used in various other dietary supplements as well these days. Garlic, wheatgrass, ginseng, aloe vera, spirulina. Okay. Then bodybuilding products, amino acids, protein powders, anabolic metabolic muscle building, creatine supplements, okay, BCA supplements, okay, branched amino acid supplements. These are different types of supplements used for bodybuilding purposes. Then laxative supplements, those who suffer from constipation and all, psyllium husk, wheat bran, weight loss products, lecithin. Okay, these are lecithin and all is available in formulas. Okay, prescription based formulas. Then you have biologic and nutrient supplements, antioxidants, fish oils, bioflavonoids, combination of some cereals, pulses, nuts, milk products, amylase rich food. Okay, these are naturally occurring food which are uh, specifically marketed for a specific nutritional purpose. Okay, like antioxidants from fish oil, omega-3 fatty acid. These are naturally occurring. Okay, but it is synthesized in such a way that it can be mass produced and sold. Then you have diet and inflammation. When you suffer from obesity or overweight issues, it will definitely lead to some inflammatory disease conditions. It is very well known factor. Why? When you suffer from obesity or overweight issues, usually 99% of the time, you are suffering from insulin resistance as well. What happens in insulin resistance? Your body is not able to take up glucose from the blood. You are eating food, glucose is getting absorbed. Okay, carbohydrates are getting broken down, turned into glucose. It is being absorbed. It is getting into the bloodstream. But from the bloodstream, it is not moving ahead. Okay, it is stuck there because it has to go to the next step, that is go into the cells. Okay, from the cells, it has to go into the mitochondria, get converted into energy. Okay, that's how the mechanism goes on. But if the cells don't accept glucose, there is no energy that glucose can provide in the mitochondria. Okay, that leads to fatigue, weakness, low energy, always tired kind of a behavior. But if the glucose is not getting inside the cell, where is it going? What is happening to the glucose? Because blood cannot hold on to the glucose for a long time. As much as it is possible, blood is keeping the glucose in flow, in circulation. But it also comes with a cost. Okay, when the glucose is not able to enter the cells, it is in the circulation, in the blood circulation, it changes the pH of the blood. Okay, your blood becomes inflammatory in nature. Glucose in blood for a long term, okay, it causes inflammation to the nearby cells and tissues. So the body knows this. Okay, we cannot keep the glucose in blood for a long time. Otherwise, slowly it will start uh, engaging with the cells and tissues and try to damage it. So what is the other option? Let's store the glucose, convert it into fat and store it in the body. Okay, because liver and your muscles have an optimum level till which it can store glycogen, glucose converted into glycogen. Above that, it cannot. Okay, it has a certain capacity. It cannot go beyond that, your liver and your muscle. But your adipose tissues can, right? So that's why excess of glucose in the blood gets converted into fat and it is stored in the body. And your adipose tissue can stretch and go on like that, increase in number if it is not adequate. Okay, to accumulate more fat, glucose that is converted into fat. Okay, and that's how you eat a lot for energy. You never feel full. You're always hungry, and you're putting on weight. This is insulin resistance, and this cycle goes on and on till you become obese. Okay, And why inactivity is there? You do not have the energy for activity. That is why you have inactivity. Okay. So this is how obesity and inactivity could lead to low grade inflammation. And from low grade systemic inflammation, it can become some long term diseases, okay, which are much more difficult to cure later on. And this is an anti inflammatory food pyramid. The same image is given in the textbook. You can refer that as well. Or you can call it an anti inflammatory food. So, people who are suffering from obesity, overweight issues, okay, risk of cancer, acne, lots of pimples, hair fall. These are the foods that you can focus on having in your diet on a regular basis. They have anti-inflammatory properties. Okay, vegetables, raw, cooked, at least five type of vegetables a day. Fruits, usually the cherries, berries, and cherries are packed with antioxidants. Beans, legumes, at least once or twice a day. Pasta, just 2 or 3 times a week. Okay, whole grains or cracked grains, 3 or 5 servings in a day. Healthy fats on a regular basis, especially when it comes to omega-3 fatty acids from fish or from flaxseed, on a regular basis, it has to be taken. Then for non-vegetarian, fish, shellfish and all, sardines, commonly found in India, mackerel sardines, whole soy food, cooked mushrooms, some natural forms of protein like natural cheese, yogurt, eggs, chicken, and poultry meat. So these are the anti-inflammatory food pyramid. Okay. The same food pyramid is available in the textbook as well. You can check that. Even chocolates, but in a limited quantity. Wine, nowadays it's not suggested. Okay, no form of alcohol is suggested, even if it is for antioxidant benefits or anti-inflammatory benefits. Alcoholism, any form of alcohol is not suggested. Then we have prebiotics, probiotics, symbiotics. So prebiotics are, pre means before, food that you eat, food that you give to your body for your bacteria. Let the bacteria enjoy their meal and then you have your meal on a regular basis. Okay, that is prebiotics, food for bacteria. Okay, these prebiotics are substances that can only be metabolized by your gut bacteria. Even your own enzymes, your body enzymes, bile salts, acidic environment in your stomach is also not able to break down certain food. Why? Because that is for the bacteria. Your bacteria can do that job properly. Okay. So those type of food is called prebiotics. They are not digested well in the intestine, and they undergo fermentation in the intestine. Because by fermentation, your bacteria is having a feast on this. It will also help in the growth of good bacteria, and also the more good bacteria you have in your body, you will be more healthy. People who are unhealthy, who have diseases, you will see certain strains of bacteria missing in their body. Okay. So these kind of studies are also done these days. What kind of bacteria is missing in a host body, and what kind of diseases these hosts have who do not have certain strains of bacteria. So that's kind of a next thing in diet. Probiotics are live bacteria that you have. Okay, probiotics you get from all the lacto-fermented pickles, curd, yogurt, buttermilk, cheese. Okay,
they all have, to an extent, lacto-fermented bacteria, okay, or any form of bacteria, live bacteria. But what happens is that when you have probiotics, let's say if you're having chas or when you're having curd, millions and millions of probiotics are available in that. Trillions of probiotics, maybe. But all of them don't get through your stomach because your hydrochloric acid in the stomach is too strong. Okay. So if you have curd today and you say, oh, I had some probiotics in my lunch today. Okay. Now next week I will have curd. That doesn't work. If you want to change the algorithm of bacteria, good bacteria in your gut, you have to stick to a certain type of fiber or a probiotic or a prebiotic at least for a week or 2 weeks, and then shift to something else, a new form of probiotic and prebiotic. Okay, just having a salad for a day or having curd for a day will not cause much changes. Okay, on a daily basis, you have to introduce again, reintroduce, and again it goes on like that. Why? Because majority of the probiotics that enter your system are not making it even till the duodenum. So on a daily basis, when you push them through, okay, you will have enough. You will within a week you will collect enough bacteria which can reproduce, okay, and maintain that colony of bacteria in your gut. Okay, symbiotics are the combination of probiotic and prebiotic, certain food combinations. Okay, like for example, if you're having banana lassi, or if you're having banana with yogurt, okay, if you're having berries, some blackberry, strawberry with yogurt, you are combining prebiotic and probiotic. Okay, so symbiotics, they will give you much better result. Then usually they are like in dietary supplements also they are formed. Some if you suffer from IBS, inflammatory bowel syndrome and all, the gastroenterologist will suggest you certain medications. It's a live bacteria medication. Okay, so usually they come in combination: bifidobacteria, lactobacilli. Okay, uh, like in these kind of different combinations, inulin combination with lactobacilli. Certain combination is prescribed in which one part is a live bacteria, the other part is a prebiotic. Okay. Fermented milks, yogurt, kefir. Okay, these all are good. Yakult, fermented milk is Yakult. Okay, you must have seen the advertisement for it. That is a symbiotic. These are the examples of prebiotic and probiotics. You can see asparagus or any raw vegetables and all. Okay. Wheat bran, garlic, banana, they are probiotics. Sorry, they are prebiotics. Food for your gut bacteria. You eat it, you will also enjoy the taste. Your gut bacteria will also enjoy the feast. Okay. Probiotic is good bacteria, live good bacteria that you eat, because in probiotic milk or fermented milk, already live bacteria is there and you drink them as it is. Less than half of them, just 5% of them will survive your gut uh, acid and go into your intestine. Okay, yogurt with some berries, sour cream, kefir, these all are examples of probiotics. Pickles, okay, lacto fermented pickles, vinegar fermented pickles. Then you have artificial sweeteners. Under that, different types of artificial sweeteners. Okay, first is low calorie sweeteners like polyols, sugar alcohols. Okay, they in even in natural form polyols are available, but usually the ones we use are industrialized. Okay, starch, sucrose, glucose, xylose, lactose. These are sugar alcohols, which is industrialized and is used mannitol, maltitol, lactitol, isomalt. These are the examples of polyols, sugar alcohols.
Then you have a non-caloric one, which is 0 calorie. Aspartame, Acylsulfame K. Okay, aspartame, it is controversial now. A lot of cancer risk has been associated with aspartame. Research is still going on. Okay, nothing is verified yet. Saccharin, sucralose, even stevia, which is natural seed sweetener. Okay, they all come under. Even monk fruit extract and stevia are natural sweeteners. Okay, so these are non-caloric ones. They don't give any calories, 0 calories. Stevia and monk fruit extract are the natural ones. Stevia is at least 300 times more sweeter than your regular sugar. Next is food and drug interaction. You just have to go through it, just read through it. Don't study it in detail because it is usually used by practitioners, clinical practitioners, okay? Because they are the ones who should know about different drugs. They have the knowledge of different drugs, and they are the ones who should know how different nutrients will interact with drugs, okay? So for others, just understand it. There is a food nutritional and drug interaction, because when you're studying about diet therapy, you're modifying your diet to suit certain medical requirements or to suit certain prescription requirements. Okay, so all the doctors here, they will definitely study about drug nutrient interaction. Okay, the result of action between a drug and a nutrient. That will not happen if the nutrient or drug is alone. For example, if you're just taking calcium supplements, it's a normal day. But if you're taking calcium supplements along with some iron supplements, okay, iron-rich food. Iron-rich food is your nutrient. Calcium supplement was a drug. Okay, so that will form some combinations which could be harmful for the health, not able to digest it properly or absorb properly. So food drug interaction, it's kind of a broad term, okay? How different food will change the way how drugs act in your body or medicines act in your body, and also how medication will affect your nutritional status in a long term. Certain medications, if you start eating it, certain high dose antibiotics and all, you will not feel hungry at all. Okay, your appetite is gone. You don't feel like eating anything. If you're admitted in the hospital and some specific class of antibiotics is prescribed to you, high dose and all, you will not know how to have food. You will forget about it. Okay, you will not feel it. You always feel bloated. You will always feel full. What is happening here is drug is interacting with the nutritional requirement of the body. Okay, so these are different examples are there. Some lot of tables are there. Okay. So those who are from the medical field, just go through these tables. Table numbers may differ, but the table name which is there, can just go through it. Yeah, numbers will be different, but please make note of the headings, okay? Those who are from the medical background. Because in detail about different drugs and how they interact with nutrients are given, okay? So that is not important for the non-medical students, just an additional information for students who are practicing in the clinical field. Only for them, these topics will be important, okay? Nutrigenetics and nutrigenomics, and another chapter is there. We'll discuss that in detail there. Okay.